And as you observe, the COVID protocols are being adhered to. People sanitize once they come in and out of that Accra International Conference Center. Everybody is expected to wear a mask, and that is because COVID-19 is still lurking, this time doing more harm than what we experienced in 2020 here in Ghana. You may want to call it the first wave. Well, let's take you live to the Ministry of Information, where Director General of the Ghana Health Service, Dr. Patrick Boaje, is speaking to us on a fight against the virus.
And the same thing is showing here that it's actually going up. We've not reached the July peak like we do, but currently we are still having a steep rise, and we need to really work hard to bring that down. The next chart shows you that the active cases compared to ever reported cases to the right. So you can see that Greater Accra remains quite deep where the last number of cases are there. Going up.
Apologies on the sound problem. We will rectify that and take you back to the Ministry of Information. But the voice you heard is that of Dr. Patrick Boaje, Director General of the Ghana Health Service. And what's happening is that they are giving us some pictorial representation of the data that has been collected so far. And just before we got to the one that shows the Ghana map in terms of regions that have high active cases, we were shown the graph that shows the level, the rise and peak of the coronavirus pandemic. Let's take you back now to the Ministry of Information.
It's going up, and we need to really work on that. That's just a summary, just an indication of what we are talking about. In the same way, the number of tests being done is also increasing in response to the positive case. Obviously, as you have more positive, you have more contacts, and of course, we do more tests. And so we are doing a lot more tests than we were doing prior to this current surge. The age distribution of even the current cases still remains about the same. It's really not much. It's about still the aged, the middle aged, and the children are still quite low. What we are also noticing is that unlike the previous one, this current surge, the number of people who are sick, the proportion of people who are falling sick is significantly high. It's about 32 compared to 21% earlier. And so this is, but I'm sure there are still people who, because of the way things are going, are not reporting, and they may not have symptoms. But for what we have, about 32% compared to the previous one, even if you use the same system we're using, the number of people who are falling sick here are much higher than before. So in January alone, we have confirmed 640, January 21st, 22nd alone, we have confirmed 646 new cases from 17 districts and 8 regions. Kwale, Klote, Ayawaso are the key areas where we are reporting the cases. Ashanti has 37 new cases in 11 districts in Accra Metro. Eastern region has 19 cases in 2 districts. Western region has 16 cases, all in Sekandita Kwade. Upper East has 14 cases in Bogatanga municipality, and Northern region has 4 cases from Tamale Metro. So these are the numbers we are currently dealing with. Ahafo has 2 cases, Volta has 1 new case, and the remaining 8 regions had no case, but they are having some active cases who are yet to recover. So if you look at, for example, Greater Accra, you can see that it's still concentrated in Accra Metro and its environs, whereas the districts far away from Accra remain quite relatively low prevalence. So you can see that between 1st and 22nd of January, Jowolo, which has a treatment, a testing center, has about 574 cases. And these are the number of districts that has reported more than 10 cases in this period. And that tells you that the situation is quite alarming, and we need to look at that. Almost every district in Greater Accra is involved. This is a national and nationwide, but you can see that mainly Accra districts are the one reporting cases more than 10 and above. So what about treatment centers? We have, as I said, we have also reported a significant number of cases. And we have about 411 beds. What is currently in use, about 133 beds. And if you look at the next slide, you can see the total daily admissions since the 4th of January has been going up. And of that, we have severe cases, which is also going up, and critical cases are going up. And so that's the trend we are having now. The cases are going up. The people who are falling sick, critical and severe, are also going up. And these are mainly in Greater Accra. So far, we have roughly about 50 or so cases on admission outside Greater Accra, but a significant number of cases are here in Greater Accra. What has been the KIA, the airport issue? So far, we have about 1,085 cases that have been reported. 62% of our males. Ghanaians account for about 41%, and the total tests done there is about 144,383, with a cumulative positivity rate of 0.75%, relatively lower than what we report in our, but they also contribute to the number. As you can see, from 1st of September up to now, the numbers continue to show an increase in positivity, a number of positive coming out there. January alone, we've not ended January, but we've already reported about 380 positives compared to the 46 in September and 393 in the whole of December. We'll see where we get to at the end of January. So you can see that there's an increasing number of positives as they come into the country. And the positivity rate for the airport continues to rise. That is if you look at January alone. It's the cumulative positivity at 0.75. But if you take the month by month, you can see there's an increasing trend in the positivity rate. I think the country of departure still remains Nigeria, USA, and the UK, forming the bulk of the people who are testing positive out there. And the third flights of arrival cases, about 88%, incidentally, we have African world, which is a sub-region, coming up. And incidentally, there's also an increasing number of positive cases in the sub-region. And there's a whole ECOWAS sub-region are having a surge, not just Ghana. And so we are also picking up a lot of cases from as they bring in from the West Coast. Of course, BA, KLM, in that order. So what do we really need to do? Even though we have not demonstrated the variant, the new variant, that's the South African and the UK one, within our community set, which we are still doing. As you know, when we isolated people at the airport who tested positive, we found cases of the UK variant and a case of the South African variant amongst them. The chances are that we may have them, and that may be responsible for the increasing number of spread. But the search will continue to see whether we actually have a community presence of the variant in this country. And we looked at maybe it's a variant that has come to the whole of the West Coast that is actually spreading, especially if you see the number coming from Nigeria into the country and other parts of the world where we have the variants. Increase the number of tests conducted by the lab has also, because of the response, definitely we need to continue doing the more tests, identify most positive, and look at isolating them. Obviously, the non-adherence to the protocol is a major challenge. I'm sure when We've not done assessment, but we're going to start one this week. Ever since people started seeing the surge, I can see the mask wearing is improving. And increased number of positive travelers is also creating a problem as part of that. The non-adherence of safety protocols during parties and all other unauthorized places where people are not supposed to be is also part of the problem that we are feeling. Obviously, people are also walking in to have a test, and there's unlinked to anything, so it takes a few days longer before they're identified and isolated. That's also creating part of the challenge that we're facing. So far, when it comes to the schools, we've only recorded, for the 1 week that the school has reopened, only 3 cases in the Upper West, 2 schools in Upper West, where a school that had to, I think there was a case that brought him from Burkina and infected, but these are all under control. We also have 1 case in Western region in Daboase. Otherwise, no region has reported any outbreak so far in the schools that has reopened. And that's quite, we hope it continues like that. Currently, we've strengthened contact tracing in Greater Accra. We are providing additional logistics. Further number of contact tracers have been traced so that we can actually mop up the surge that is coming up. We've placed data and surveillance officers at the private labs so that anybody who tests positive is immediately linked to care. We've intensified risk communication. Our team and Greater Accra team will meet in the GPRTU, market points, etc., to be able to talk to them to ramp up the use of the protocols, adherence to the protocols. We also, as part of our accessibility to test, we are reviewing our policy to allow the use of, now we have 2 antigen tests that have been certified and registered by FDA. We are going to use them to look at when there's an outbreak, we can quickly do a test. In hospitals where there's a case of exposure by health workers, we can use them. We can use them in schools and other places. And those who are test positive, we may confirm with PCR. We are very confident because even the antigen tests at the airport, anytime we did a comparison with PCR, they are almost apart. And so we are very confident that the antigen tests will be very helpful in making us respond faster and also be able to reach out more people in a very short time. We're going to get our public health labs to run 24 hours. We are opening a new one at Ghana East. I'm sure before the end of the week it will be operational so that more people can be tested. We are also encouraging that if you have a reason to test, even for those who self-elect to go and test, because you feel you are exposed, or because you feel like contact to somebody or whatever, I don't feel unwell, once you have that mind, you need to self-quarantine yourself until you see your results. And that is part of an important protecting your own family and everybody else. So it's very important that once you decide you have a reason to test, you self-isolate until your results come in. And when your results come in, you are positive, you isolate that. So you quarantine and then you isolate. To decrease community spread, we will also get in additional
apologies for that. That video was interrupted, but we were just hearing from the Director General of the Ghana Health Service, who was just beginning to tell us measures that are being put in place to deal with the surge in the coronavirus cases. You just heard that they were going to run a 24-hour testing laboratory and also open another at the Ghana East, which may be operational during the week. He's also told us about a new form of testing regime for persons who work in the health sector who may be exposed, which is quicker and may help detect the virus early so persons can be attended to. We've got a feedback now. Let's take it there.
Some cell prevalence to see what is happening in the community, which we've started already. And of course, we expand our collaboration with the GHS on education and prioritize communication, especially our engagement with the press, to ensure that we are continuing to put the information, and also hope that you also help us provide appropriate information to people to adhere to the protocols. Ladies and gentlemen, this virus is something, we also want to promote decongestion. See, what we don't want is if this thing was to also get into our workplaces, there'll be an explosion. So we're recommending decongestion of workplaces. Those things that can be done virtually, let's do it. Non-essential staff can be doing shifts so that we have fewer people in the offices so that we don't really spread it. Because this virus spreads among acquaintances. If I have it, the chance that I'm going to give it to my family or my friends, the people who meet fast, they are the ones. And so as we learn that, we also continue. We continue working with the schools so that we continue our surveillance to ensure that any outbreak is quickly nipped in the bud. So finally, Honorable Minister, I think I just want to say that this virus is thriving on our very way of life. How we commune, how we worship, everything we do, and that is, as a people, that's what the virus is trying to take advantage of. What the protocol seeks to do is to see how we modify so that we can also destroy the strength. So we need self-discipline, and we need all of us to also help us enforce this change that we need so that we can avoid the spread of this deadly virus. Thank you very much.
Thank you, Dr. Boaje, for that update. Colleagues, I just want to highlight a few issues and then we'll take questions. First is that now we have active cases in all our 16 regions. I think a little over a week ago when the president spoke to us, we were having active cases in 13 out of the 16 regions. 13 out of the 16 regions. But now we have active cases in all 16 regions. The graphs, if you can go back to the graphs as Doc showed us, we're having what Doc describes as the third rise. So you notice the first very difficult one that we had, that was in the initial phases, and then somewhere in the middle, which month was that one? The second rise was in which month? October, November, before the Yuletide, we succeeded in getting it down, and now we have a rise which is even higher than the October, November one. Our average daily new cases, the 7-day moving average was around 200 at that time. It appears to be ticking a bit higher, and that's why we are all being called to sharpen our response to the preventive etiquette. Doc also mentions that they are observing, and I think it's key, and you have to help us to communicate it strongly to the public. They are observing that with this third rise, there appears to be more people who are falling sick as against the previous scenario. You know, at first we all got used to the word asymptomatic, which meant that there were very few people who were falling sick. That was around 20 what? The percentage that you mentioned was about 21%. Now, they're observing about 32% of the people who are testing positive are actually falling sick. Then he mentions that currently, if you look at the number of people who are having severe conditions and critical conditions, the numbers are going higher. We have a limited number of beds and ICU facilities for severe and critical. So it's very important that we ensure that the positive numbers go down. Because if this trend continues, as His Excellency the President mentioned, we will be overwhelmed if this trend continues. So what we have to do is to ensure that the curve is brought down as quickly as possible, because with this third rise, the asymptomatic is not something that everybody is having. They are having a higher percentage of people who are falling sick. And I think it's something critical that you have to let the public know so that more people take it seriously. On school matters, he's mentioned that so far only 3 cases have been recorded, but they are being well managed. I think the general philosophy is that as schools have reopened, etc., there's a possibility you will have cases, like what happened in Accra Girls when the limited number of students went to. There's a possibility you have cases. But the idea is not to panic, and for all of us, even in our reportage, etc., not to press the panic button, but to allow the system they've put in place, the mapping of the schools to health facilities, etc., to take care of those who may test positive. One of the exciting bits of news that he shared with us today is the fact that we are going to step up our testing, even including antigen tests across communities, etc., etc. And he'll probably provide some more detail as we go along. But these are highlights that I feel obliged to raise so that you can also hit it a bit harder in your reportage. We'll take questions. I'll let my colleague set up the microphone. But Doc, I have a question that I want to start with. We are resuming our very regular briefings, but the last set of briefings that we did, you mentioned that we were having some gaps, particularly between the private labs and the public health system. And that was creating a disconnect for contact tracing, etc. Are you able to tell us whether the interventions that you sought to roll out, including putting some people at some of these labs, making the online platform available to them, whether they are working, and whether that gap that came up between the private labs and the public health system has been closed effectively? That would be my first question. Colleagues, 1, other questions, 2, 3, 4. Let's take the first 4 and then we'll come back. So 2 at a time behind the microphone. Let's take the first one. If you need the microphone adjusted, please let my colleague adjust it for you. Do not touch it yourself. Chairman, wear the mask. It's when you are talking that you have to wear it more. Thank you, sir.
Nigeria. Is it the case that we are not able to police our borders and therefore we're facilitating people coming in with a disease? And if that's the case, what are we going to do to block these people? Because definitely they come unannounced and unnoticed. My second question. Hello, Minister. We all know that countries like UK, Saudi Arabia and co. have placed embargo on air travels. As a country, can't we restrict movement? Maybe allowing only emergency and very urgent travels, maybe for very urgent goods or machinery or whatever we need for the time being because of the upsurge of the disease. Because I've learned that some people test negative at the testing point at the antigen, whatever they call it, but they go home and write that they have caught the disease. So if we can restrict movement and allow only important and emergency travels, I think to help the country. And then supply of PPEs. I think there's a general complaint that because we want to relapse somehow, supply of PPEs have not been very encouraging, and they are saying that some hospitals and some clinics don't have them. What's the plan made by government or the Ghana Health Service as it were to revamp the supply of PPEs for the various hospitals and clinics? Thank you very much.
Thank you. My name is Ataminsa from Ghana News Agency. Yes, I wanted to emphasize on the lack of PPE because I've heard some heads of schools complaining about lack of PPE in their schools. And then lack of space at the schools to ensure social distancing. So what are you doing so that there will be enough space for the pupils? Then desk. There's also been complaint of lack of desk. And so what are you putting in place to get desk for the pupils to sit on? The last time the president spoke, it's more than a week, and he said there's community testing of the new variant to find out how wide it has spread. I want to find out the timeline that you complete that community test to know how the new variant has spread among the community. My last question goes to Honorable Kojo Opankoma. Regarding the funeral of the former president, on Wednesday, that is when we have the burial service. As you communicated earlier, there will be full military honors. You'll be given full military honors. If you say full military honors, what do you mean? What constitutes full military honors? What are some of the activities that are going to be rolled out to see that, oh, this is full military honors? Thank you.
Hello, my name is Yapeko. I work with Atinka TV. I want to speak in the local dialect. First, we find out say diplomats na free outside there by yin. Besi who say then she says from Corona abayin no dia tuja e dia mom say ne omo import yare ni bi san fan be kan ne wa hade da no. And lastly so me person me find out say yare no increase na cost. Okay, say cost. And I say if the trend still continues, if it still continues, will it be a possible lockdown?
Thank you, Doc. In your presentation, you indicated that many of our cases are found among the middle class and the upper class. What accounts for that? And does it not affirm the notion that this virus is for a particular class of people? Thank you.
It's Kafoyari. I'm sure you've seen that video going around. Yes, sir.
Yes, sir. Good morning. My name is Manuel Conte. I work with JoyNews. Some quick questions. First two on the vaccine. Now, I want to know what the concerns are about the vaccine and the extent of protection that it will provide. We've learned that in the UK, for instance, people who have taken the jabs are still able to transmit the virus. So we want to know that. And then Dr. Patrick Kumabwaje earlier mentioned that though we've not detected officially, there's reasonable cause to suspect that we have the new strain within the community. And so on that, we want to ask what the briefing is on the efficacy of the vaccine to deal with the new strains that are being detected. We've also seen, and this just to reemphasize, is a question that's been asked that we've had WAC-BIP's director, Professor Gordon Awandari, we've had a GMA, Dr. Titus Bayu, and so on, request and demand that we reintroduce some restrictions, if not a lockdown, at least a ban on public gatherings and so on and so forth. This is something that government is considering. We also want to know what the protocol is for burying people who succumb to the virus. We know earlier there were, some burials that were being conducted by Metro and so on. What has that changed? We want to know. And then finally, on the enforcement, there's been calls to request a revision of the EI that puts punishment for not wearing the face masks and so on, sometimes between 12,000 cedis and 60,000. I want to know if government is considering tabling another EI to review the sanction regime so that we're able to enforce properly. Thank you.
Thank you. So we'll provide answers to these, and I'll just take the ones that were directly for government. Manuel, just a point. Doctor didn't say that there's reasonable cause to suspect that is here. He said it's possible. Yeah, that is it. But I just want to distinguish. Sometimes you know these things. Then before you realize there's a headline by somebody else who didn't hear the whole conversation. So I just want to be clear on that. He didn't say there's reasonable cause to suspect. He's saying that the data they have currently from the community test they've done does not show that it is here. But it's possible it's here, and therefore they will continue doing their research work. But your question really was about the vaccine and how it will relate if we have that. So let me deal with the issues for government. About 3 questions. Manuel and 2 other people is about the same question. Is there the possibility of a lockdown or introducing some more restrictions at some point in time? Yes, there is that possibility. And if this trend continues, that is where we are heading. I want to be very clear about that one. Yes, there's the possibility of some more restrictions being introduced, but especially as this trend is going, if it continues, then that is exactly where we are heading. We are being reminded that we all need to do the things that we were doing in the beginning that would ensure that this third rise, we can quickly curb it. Because the dynamics of this third rise appear to be a bit different from the first 2 that we had, including the number of people who are falling sick, severe and critical, as we discussed. So especially if these numbers keep going, average daily new cases of 200, if it keeps rising to 210, 250. Then in 5 days, you are hitting about 1,000 plus. If it keeps going the way it is going, I think as the president himself articulated, then we are heading for some more restrictions. And if it means reviewing some of the legal instruments, yes, that is where we will be heading. There's a question about the diplomats who will be coming for the former president's burial service and related activities. Yes, they are also being screened, just like what was done for the presidential inauguration. So they are all being screened, and the same rules and the same protocols apply. Then one final question for us about what we mean when we say full military burial. What it means is that His Excellency, the former president, will be accorded the status of a commander-in-chief. He was the commander-in-chief of the Ghana Armed Forces. He will be accorded the status of a commander-in-chief. So, you know, like they do in the military, when a one-star general passes on, they have the kind of things that they do. And the same is accorded, for example, when a vice president dies. I think that's a 19-gun salute and other things that come with it. But this is a CIC burial. And so you would notice that all the respects that are accorded a CIC is what His Excellency, the former president, will be accorded. That's a 21-gun salute and all of the other things. So I'm sure our colleagues in the military can provide the specifics and then some more detail, but that is what we mean. Doc, let me come to you, but just before then, let me speak to this Nigerian phenomenon matter. Doc's point was that the flights that are coming in, you'll find out that a lot of the cases that are turning positive are coming from Nigeria. He wasn't talking about the illegal routes, correct?
I didn't say that. It was more from the West Coast,
yes,
which is where our flies in. I was in relation to the hour reports, yes, the number of positive flying into with our goes to Nigeria, Sierra Leone.
Yeah. Africa World Airlines, yes, which picks a lot of people from across West Africa. And that's why I was making the point that there appears to be a surge around. But I want to say something about the illegal routes question that you have been raising. Yes, there are some illegal routes, and there are Ghanaians who try to smuggle other people through the illegal routes into the jurisdiction. It's important to let the word be clear that if there's a surge around West Africa and you are happily in the business of helping people to come in, then you are contributing to our case burden as is now, and you are putting yourself at risk. I always say that you're the one who rides the motorbike to go and pick him and bring him. You are the first person who is at risk of contracting it. So if you think that you are beating the system, if you think that you are being smarter than the attacker, you are putting yourself and your family at risk in the very first instance. And I think it's important that you let the public understand that. Doc, I yield to you.
Yeah, thank you very much. I think there are still a few more questions that I'll leave for the Honorable Minister, especially restriction to travels. And yes, on the issue of the linking to care, we have actually trained our disease control officers and other health workers to be part of the lab. We're giving them the software, we're giving them computers to be able to directly collect the data and share with us. There has been a significant increase in the number, as you can see, the number of even reported tests that we are reporting. But we can still do more, especially in terms of the timing that it comes in. We just started last week. We are hoping that this week we'll see more improvement. And so that's allowing us to be able to do more linkage to care. And but still there are people who just are not able to be traced because they just ask for tests and they come. So it's really improved our ability to capture the data and respond appropriately. We want to get that in real time, and so we still have more work to do to be able to do that. Supply of PPEs. We are not aware of any such shortage. You know, in the initial phases, we have a lot of local production of PPEs. See, when we say PPE in the facility, there are many. It's mainly the masks and a few gloves, etc., where we need additional equipment is the treatment centers, and that we are okay for now. But of course, we continue to resupply PPE. So the PPE, even in our own facilities as a health sector, is also adherence. Even amongst our own people, it's a challenge. And so we continue to work on that. We're using association to engage that everybody in the hospital also does not think that my colleague is safe. And so we're encouraging them to wear that. So we are not aware of any shortage of PPEs. But if there are instances, and we have quantities in our regional stores that we can look at that. If there is, it may be a distribution problem, and those facilities should quickly know how to quickly respond and get them. How long do we need for the variant? I think it's not as simple. It took us about 3 or so weeks to get the first phase out, and so the team is still working on it, and as soon as the report is ready, they will. And it's a continuous process. You don't stop. You continue searching. We've been doing this genome sequencing all along. As we spoke the other time, as at November, they had not found anything among the community. When we isolated the people who are travelers who were positive, we found the variant, as had been published. We will continue within the community search, and if we find one, so I cannot say it will be 3 weeks, we come and tell you we don't have, because you continue searching. You don't stop that, oh, I've done it for 1 month, and so I can stop. You continue searching until you find one, if there are. So I'll not be able to, as soon as they found some, you get to know. Like the Honorable Minister said, every outbreak has its own characteristics. This current surge is as a result of the Yuletide, and so the people who celebrate it most are more likely to be better. As it means it's going to remain there. What it means is that it could also spread to other places, and that is why we want everybody to protect themselves. It's not that it's only there, but it's predominantly that group. So this issue of a Sikafo area, when we saw the July one, it was not a Sikafo, it was everybody in Accra, in Ghana. And so depending on the event, if it happened at a funeral, the people who are at the funeral who get it. If it happened at the wedding, the people who attended the wedding who get it. And so that's how the disease operates. But once they get out and they become part of the general population, obviously everybody else is at risk. And so let's not create that impression that it's going to remain there, because once they are out, everybody else could also be affected. The information we have about the vaccine is that there's no current evidence that shows that it will not work against the new strains. But I'm sure work will continue going on until such time we'll find out whether it is. What it also does most is that it at least can prevent you from getting a severe disease, because it generates you to raise antibodies to fight the virus. And so I think that's also an important factor. Subsequently, we'll see whether the antibodies is able to prevent you from even catching it at all. And so these are all an evolving matter that we want to do. But the most important is that you are not able to generate even enough virus to be so transmissible to other people. So that's where we have. But I'm sure we'll continue looking at that. There was the issue of, you talked about Titus, mentioning lockdown. Well, I think the minister has mentioned it. But it's also very important for us to say that if I am speaking, you are saying, the father, I'm almost a member of GMA. Am I speaking for GMA? I'm speaking for myself. And I think it's important that we always clarify that position very clearly when anybody is speaking. Whether are you speaking for GMA or you are speaking for yourself as an expert. I think that's very crucial that we look at that. The protocol for the burial, I think it is the same. It's supervised burial, which means that we need to have professionals to manage. What we have done over the period is also beyond the environmental health people, also train some of the funeral homes to be able to manage and do that. And so that's why we cannot continue relying on very few people. So we train some of the funeral homes to be able to manage and provide supervised delivery on that. The last question, I don't know, is the review of the EI. I don't know whether the minister.
Yeah, I think as I mentioned, it's something that the Office of the President will be dealing with in due course, especially as you observe the current situation and if there's a need to even tighten some of the sanctions, etc., under it, I'm sure in due course it will be announced to us. Just want to make a quick comment on the vaccine matter, and then 2 notes, and then I'll take the final batch of questions. So the subcommittee of the COVID-19 response task force that has been working on the vaccine policy has done a lot of work from last week and has some proposals which will now hopefully be signed off at the presidential task force level. I've seen reports that suggest that the policy is already been approved and that these are the people who are going to take it first. I'd like to inform you that that is not the case. Those are proposals from the subcommittee, and then it will go to the task force for some final decisions or possible modifications, etc. And once that is done, the president himself will announce or will cause to be announced what the final policy is on who is getting it first and who is getting it next. So please stand by for that one. Later this week, we'll be joined by the Ghana Police Service. They've made a number of arrests across the country of persons who are not complying. They'll join us and give us an update on the enforcement. And then the Ghana Education Service will also join us with an update on the entire school reopening program and where they are in terms of the scheme of things. I'll take a second batch of questions before we go to the final batch. I see one hand at the back. 1, 2, 3. Is there a lady? 1, 2, 3. Is there anybody else? Yes, sir. Please step forward, 2 at a time. Should I take this to be the final batch? Or are there any other takers? We'll consider this as a final batch then. Manuel, you have a question? Okay. I'll bring you back afterwards. Yes, sir. Go ahead.
Okay. Honorable, good morning.
Morning.
Pastor, if you poku me free Kingdom FM.
That's saying.
Congratulations. So I was saying, can you be more?
May that say.
You wait a minute. Question, Dr. Kuma Boaje. There are reports of Kuma HSA from January. January, there 3 weeks. You know, never be 32 kwana like me through COVID-19. If I say confirm, I say I'm pampa say me 32. Ne just within this. 3 weeks na ampampa na say enye sign December cho bit ma clarify my kakra. The next question here, this new cases here can say like variant now say bia from UK ni South Africa there no. Again na you say earlier by the name say Nuguchi for check here first virus no. Yes see you almost say no mo sutie say no mo sesa. As Nuguchi for Omo and as a government health service Omo share and as Omo monitor so I should say and we send away to new way next year how else bit me about to issue one that's it.
Okay. Yes, sir.
Yeah. Good morning, Honorable. My question is, as our schools have been opened, have there any plans of government to test the teachers who are going to be dealing directly with the students in order to avert the contraction of the disease? I think.
Thank you.
Thank you.
Yes, sir.
Good morning.
So do you have a plan for testing in schools? Yes, sir.
Yeah, he stole my thunder, but I'll still go ahead. It's about genome sequencing. We did one in April of last year. It's been almost a year. Have we done any further genome sequencing to see whether the virus has evolved to have more Ghanaian characteristics,
okay,
considering that there's a more virulent version of the wave going on? And you've already talked about lockdown and its imminence, but I'm wondering, last year in April, we went on the lockdown at 141 cases. We are at 3,200 plus. Why are we now still issuing caution notes and telling people it is imminent when there's such a huge surge? Those are my questions.
Thank you. I like that question. We'll have an opportunity to explain.
Yeah, Doc. On the Ghanaian Times front page today, we have a professor advocating the adoption of hydrogen peroxide as one of the treatment medication. Can you throw more light on that for us?
Good morning. My name is Tina Moses from Asasi Radio. Please, I want to find out with the COVID testing, the cost of it. Now, it seems to appear that the quicker you need the results, is the higher you pay. But now you are urging all of us to test to know our status. What is the ministry doing about this? With the private sector, I understand it's between 500 and 700. That is, if you want between 12 hours, then you pay 700 cedis with the private sector. And then in the government sector, you pay 150 cedis. But here are some cases, in this case, that people are home, people are jobless, because I did some interviews with some people, and they don't have money to test. So how are you treating this for us? Thank you.
Thank you, but just a correction. Doc has not asked all of us to go and test. I don't think you've done that. They are at-risk populations, people who feel they have symptoms, people who are contacts of other persons. So just a correction. We have not all been asked to go and test. Manuel, I'll give you the final one.
Yes, please. Well, this question is essentially about the protocol at the airport. We have learned that indeed the air crew with the various airlines are not tested. They don't take the test before they embark or disembark. Are we, with the new rise in the cases, are we going to change that regime and get them to test before they move out of the country or get back? And on the training of funeral homes and etc. to deal with the deaths that come with COVID-19, we're asking, do the families have to bear the cost of the burial? Are there specific designations as to where they are to bury them because of concerns of Ebola? We know that some people mistakenly buried some of the people who succumbed to Ebola at places they were not supposed to have, and we are told that are the cases, in Congo and so on. So we want to know the protocols exactly with the burying. Are they paying for? Are the families having to pay for them? What exactly is the process? Thank you.
Thank you. So let me deal with, I think, the only one that is directly at government. When we went on the lockdown last year, we were at 141 cases, as you suggest. I have to check the number, but you are suggesting it was at 141. Why are we not going on a lockdown now that we have 2,000 plus cases? Let me refresh your memory. The lockdown of 2020, if you recall, was a precautionary lockdown to give us an opportunity to study the dynamics of the virus. You recall? It had nothing to do with the number of cases at the time, and we made that point over and over again. Because if it was about the number of cases, then of course, there will be a strong argument to make that then when the cases go up, then you have to lock down some more. That lockdown was a precautionary lockdown to enable us to understand the dynamics of the virus and therefore see how we would respond to it. That's how come we knew our positivity rate, our baseline positivity rate at the time. That's how come we understood, for example, the percentages of people who were falling sick and therefore decide on isolation centers, profiling of people. Some could be treated at home, etc. So it's not about the numbers specifically. But yes, numbers do play a part at some point in time, and that's why we are making that strong argument that if you look at the trend of the numbers today, and if you look at the characteristics of this third rise, and the fact that still a lot of people are not doing what they have to do to help us bring it down, we are heading for some more restrictions if this trend continues. And that's why we have to be very clear to the Ghanaian public and also encourage people to comply so that we're able to get this third rise down as quickly as possible. Doc, I yield to you.
Thank you very much, Honorable Minister. And I think just to add that if you follow the protocol, it's very helpful. There are people who have come very close to people who are positive, but because of the adherence to the use of the mask in particular, others test positive, they don't, and so it works. And so probably we don't really have to push ourselves to that way, because this has both economic, social, and health consequences, and so we need to look at the two and make sure we get that done. Concerning the deaths, we have recorded a little more than even 32 in January. We continue to update. And that is why this phase, we are creating the caution that people must follow the protocols. People must abide by the protocols and report early. There are people who stay home, they buy oxygen in their homes until it's too late before they come. We're trying to encourage that. And some of our colleagues who are going to people's home and giving them oxygen, please, they should stop. Anybody found will be severely dealt with, because that is not part of our ethics and that's not part of our treatment protocol. And I think it's something that we really need to put out there. People must come in early. Don't buy oxygen and keep in your home. Buy your pulse oximeter and stay home until you can barely breathe. Then you come. And I think that's what's causing the death. And so we hope that people will follow that. I think we talked about the new variant and the genome testing. I think I keep saying that this is an ongoing thing. It was not only done in April. Even us at November and now, it's still going on. The fact that they have not published it doesn't mean that nothing is going on. It's something that we continue to look at to see where we are and learn more about the viruses that we are dealing with. And so,
if I may interrupt you, even for me, the impression I got earlier was that the genome sequencing was to determine whether or not the new variant had come into the Ghanaian jurisdiction. So I suspect the question from my colleague is also about whether the genome sequencing has also been looking at whether or not the virus has mutated, even the old one here in Ghana. I think that's the import of your question.
Yes, that's exactly what I'm trying to say. It is something that continues, not necessarily identifying somebody's variant. It may be your own new variant. And so as you see changes, you put it out there. And that's how the UK found their new variant. And we continue to do ours. If they find one different from others, it should be named. That's what the South Africans do. So it's a continuous process of checking to see how the virus's mutation is taking place and how it's changing course. Testing of teachers is never on the card. The question is, the protocols are very important. Where there's a need to test a person because he shows signs or is exposed, that will be done. If you test 1,000 teachers today, you probably have to test them tomorrow, because it doesn't mean that the fact that they are negative today doesn't mean that tomorrow they will still remain negative. And so it is really not a useful exercise. The question is to be on alert to see what are the signs. Is the person exposed? What are the systems in place? If you are exposed as a teacher, you isolate. As you have a child is exposed, they are isolated and treated, etc., and tested, and those who are positive are removed and treated. So that's what we really need. Otherwise, we will continue testing and testing. Then the same comes, say, why don't you test the 9 million children who are in school? I don't think that is even feasible. So I think it's about being alert to some of those issues that we look out for. Hydrogen peroxide. I think there have been many things that people have talked about. There are many things, the kakadro, the ginger, and all those things. We, as a service, do not have any scientific proof that this is something that we must go. And so we cannot say that it's working or not, but we don't have the evidence that it was the same way at the neem tree and ginger and things that everybody is taking. Cost of testing. The public sector testing is free. It's free. Anybody takes money from you, it's illegal collection, and let us know. It is free, except those who have allowed specifically to test for travelers. But if anybody, you go to any public lab and they take money from you, currently, we are investigating a report of some Mamobi and other places collecting money. But it is not supposed to be. It's free. For the private sector, it's a choice. If you decide to go, you want it in 3 hours or 6 hours, and you want to pay 2,000 for it, that's it. But as far as the public sector is concerned, it is free. If you go to Naguchi, if you are referred from the facility, it's supposed to be free. If you are traveling, then you pay for that. And they are not. So those are it is. So anybody who takes money from you is illegal. It is free. And to remove that, we are expanding our capacity to do more tests run 24 hours and also access to the poor so that they can also get tested quickly. We need the results early enough to curtail the spread. But if it's going to take us a week to get the results, by the time the results come out, you spread it. And so we are also interested, but it's free. We are not supposed to charge anybody for anything. Airline crew. We don't test them because we also have an arrangement with them. They have their own testing regime. They test more frequently. I mean, you cannot be testing per flight. They have a routine testing, whether you are sick or not. There's a timeline that they all go in for a test. And so that's what like what is done for footballers, etc. The same mechanism that we are looking at. But they also adhere to the safety protocols on board so that they also are not. And so that's why we are doing. So it's not that they are not getting tested. They have periodic tests, whether you are positive or not, as long as you are an aircrew. And that's why we have agreed that they can go ahead and do that. The cost of the burial, it depends on what you want. As far as the environmental workers are concerned, the state supports them to conduct the assessment. But any other, the burial, any other ancillary thing that happens, it's not like coffins, etc. That's not the state order. They provide a technical backing for you to be able to safely bury your body, and that is not does not attract any cost. Thank you very much.
Doc, I am seeing a question on our social media platform from Kojo Asante. It says, question on my mind, I heard the concern about delivering oxygen tanks to houses. If the hospitals are full and ICU beds are not available, what are the options for citizens? Can doctor clarify?
Well, but it is better. We have places where you have ERs that are being used to provide support. If you are getting oxygen, you need constant supervision. You need constant supervision, yes. The fact that we have a choke system doesn't mean that you must keep somebody in his home, just put oxygen and go home. And that is what we are saying, that we need to use the best appropriate method, which is ethically sound, to provide care to all people. Thank you very much.
Additionally, we prefer you reporting to a public health facility so that even if you be managed from home, the doctors are aware and are doing that. We prefer that than you buying an oxygen tank yourself and keeping at home that, you hear oxygen may be a good idea. So it's preferable that you report and let the doctors even determine that they will manage you from home and send the necessary follow-ups than you buying a tank.
Honorable Minister, we have a lot of people who are managing like that at home, but at least the case management knows that there's somebody here who is moderate that we are monitoring, and they will keep on until when there's a time to bring you in, then they'll bring you in. But if you feel another hospital doctor is just without linking to anybody, and when you get worse, he has no clue, he doesn't know how to take it further. And sometimes, even if you ask them for summary, they can't give it to you because they don't want anybody to know that that's what they are doing, and that's what puts you in danger.
Yeah. So, colleagues, we're going to draw down the curtain on the briefing today. We're looking forward to having another briefing on Thursday morning to deal with enforcement, reopening of schools, and hopefully by that time, take you through the vaccine policy. Hopefully by that time, the vaccine policy would have been approved by the Presidential Task Force, and then we can take you through the vaccine policy. I see an urgent hand, so let me quickly take that one. Abednego, shout it from there, quickly, shout it from there. I don't have a copy of that report. I think what we'll do is get an update and add it to our Thursday briefing for you. I think that's fair. Okay, so thank you. Wish you all the best. Just to remind you, the final funeral rites for former President Rawlings are ongoing, but you don't need to be there in person. You can follow it virtually on television and on online platforms.
Yes, you can follow it on television right here on the JoyNews channel. We bring you updates on the final funeral rites of former President of the Republic of Ghana, Jerry John Rawlings. There you see in your shots, people filing past his body. But just gone by is the press briefing by the Ministry of Information. And we heard from the Director General of the Ghana Health Service and Minister of Information, Kojo Nkrumah. Just some highlights. people ask questions about the cost of testing, and well, we are told by the Director General that if you have to do a test or you've been referred to a public facility, it is supposed to be free except for travelers, and that's what we've been told. There's also the bit about funeral homes being trained to deal with the high fatalities, and well, we are told that that cost will be taken care of by government. There were questions about vaccinating teachers. Dr. Kumar-Boaje said that's not realistic considering the numbers, and the fact that someone tested positive today doesn't mean they will, negative today doesn't mean they will remain negative. So they will up the game in terms of contact tracing. Earlier we were shown a graph of the surge in the numbers and and how rapidly the virus is spreading. So do stay safe, wear a mask, and remember to social distance. Don't forget to always wash your hands with soap and running water, and use a sanitizer, alcohol-based sanitizer, to sanitize your hands, doorknobs, and other places that other people may have come into contact with. But there you see, lying in state, Jerry John Rawlings. Many have described him as the most charismatic president of the Fourth Republic, and clearly a lot of tributes pouring in, former associates, other presidents in the sub-region who have shared their memories of him. We've heard his daughter, Dr. Zaneto Rawlings, who is a politician herself, speak on a number of occasions about her father and the fond memories she has of him, how disciplined he was, and transmitting that sense of discipline to his children. She speaks even about how they had to share him with the rest of the world, because at the time he was at the castle as head of state and president, they barely saw him. And so she is also pleased that at least many people recognize his contribution to the African continent, to Ghana, and even to the world, especially in his role lobbying for UN Secretary General Kofi Annan to be given that position. Really difficult moments there as people see that man of charisma who had such a drive for life lying in state, lifeless. Really difficult moment for a lot of people. But as I said, it's the final state of every man. And as the banner at the Accra International Conference says, the legend lives on, and his story will be told to generations unborn, especially his contribution to the democracy we enjoy here in Ghana and the Fourth Republic.